So when we clean our teeth, we have two options. We have the manual toothbrush. I probably want to get a toothbrush a little more often than every 6 months. It gets worn and it gets dirty because those bacteria and virus and sometimes fungus are still on that brush. So you have the manual and you also have the electric, and there's all kinds of different options that are out there for the electric toothbrush. In fact, it can take the place of your manual toothbrush, so you can actually concentrate on brushing one tooth at a time. So really, I always tell my patients, when you use an electric toothbrush, I encourage them to get one, but if they do, to make sure they're holding it very lightly. I ask them not to push so hard that it makes a different sound from when it's out of their mouth to where it's in their mouth. Different kinds of flosses that are out there as well. The most effective way to do it is to push that floss against the particular tooth that you're flossing and go into your gum line, kind of forming a C, going down into the gum and down on the root. As far as your tissues will go, it will allow you to go without discomfort. The closer you get the floss to the fingers, the more easily it is controlled. The further you are, the harder it is to control it. So I usually wrap about an 18-inch piece of floss around my middle fingers. I'm right-handed, so I wrap most of the floss around my left-hand middle finger and a little bit around my right, and I can use my forefingers, my forefinger and thumb, or my two thumbs to control that floss, to guide it where it needs to go. Manual toothbrush is wonderful, time proven. Electric toothbrush is great. But you have to keep in mind that you don't want to overuse it. You don't want to push too hard, and that will. They can be both very effective.